Today we're going to be talking about analysis skills. Now, why do we have to learn how to analyze things? Take all this information that your client gives you and put it all together in some form and make sense out of it, and then come up with a plan of how you're going to help the person deal with all of this. So the basic thing we have here is, the first thing is, let's call this the basic analysis method. Finding the pieces. We have to ask all the right questions. Of course, we have some different forms that we use to gather information in counseling and in the area of coaching, which helps you gather the right pieces, at least look in the right places. Then we have to take all the pieces of the puzzle and stick them together and make some sense out of it. Then we come up with a hypothesis. Hypothesis, this is what I think that's going on here. I think this couple is in an over-under responsible marriage, as an example, which gives us an overall framework of how to deal with it. And then we might do some testing. Now, I'll just give you a list of some of the tests that we have available here. And these aren't really formal tests, but they're ways of gathering information. The first one is a codependency test. Now, we have two of these. The quick one comes out of the Love is a Choice workbook. And it is just like 25 questions, gives you an idea of how codependent they might be. And then we have an overall codependent assessment that we've developed here that will help you understand which of the 6 types of codependency this person actually has. So we might use one of those two if we want to really dig deeper into the codependency issue. Then sometimes you're dealing with people that have fears, and you want to know where their fears are. And out of the book Search for Significance, there are 4 fear tests. And these fear tests help you understand, do they have a fear of failure, a fear of rejection, a fear of punishment, or a fear of shame? And those all relate to the basic needs for love, security, significance, and self-worth. Then we have abuse tests, especially in the area of domestic violence. The one we use a lot is called a CSR, and what it basically does is it has the person that is the victim fill this out as to what's happened in their life, and then it rates the perpetrator either as not abusive, mildly abusive, moderately abusive, seriously abusive, or dangerous. So that's a very used thing to do. Another thing we sometimes use is out of the book Changes the Third Path. It has a list of the characteristics of a classic domestic violence abuser. And so we just ask the person about those different characteristics to get an idea if they fit this particular profile. Another test we use quite a bit is a depression test that comes out of the depression workbook. Another test we use, and this is for marriages, and especially for people that are about ready to get married, because it's supposed to be about 81% predictive as to how the marriage will turn out. And it's called Prepare and Enrich. And it is a professional test that we have the person take, and it's sent into Minneapolis, Minnesota, and it is graded and comes back with a big computer printout that rates them in 15 different areas, and it rates particularly that relationship. And then the last test that we use a lot here is the SASI, Substance Abuse Subtle Screening Inventory. It's the most usual one. It's been around for about 10 years. It's supposed to be about 93% predictive as to whether the person is dependent on drugs or alcohol or not. And it's subtle screening, which means that it's set up so the person can't figure it out and can't fake it. And it has all these different references. It even checks to see if the person randomly scored it, just to try and mess it up so it comes out different. And there are different defensive scales. And how defensive are they that they're an addict? And how codependent are they? And subtle attributes, obvious attributes, and so on. And so it's a very effective thing in that area. But anyway, in the area, if you want to know more, and you need more information, there are those tests, and of course there are many, many other tests out there, but those are the ones that we normally use here and that we have available to you. The next way of looking at analysis, I'm going to give you a whole bunch of different methods, then at the end we're going to take an example, and I'm going to let you try to put it together, and then I'm going to go through that example through each one of these methods of how I would analyze that one particular example to make it more concrete. This is what we might call a layering of the problem, or the peeling of the onion. The top and the beginning of it is the presenting problem. This is what the person says when they come in. You say, well, why have you come here, and what can I do to help you? And they say, well, this is what it is, and so on and so forth. It's called the presenting problem because many times it's not the real problem. As an example, the person's codependent, they think the problem is their husband. Well, no, the problem is really the codependency. So it's whatever they say. Then the next part of that are the symptoms. What are we seeing currently in their life based on this presenting problem? Dr. Crabb, who wrote Effective Biblical Counseling a long time ago, talks about how he does this. First, he looks for the negative feelings. Then he looks for the negative behaviors. Then he looks for negative thinking. And then he compares those all to the Bible to try and identify, okay, what is right and what is wrong here. The next part of the onion is, let's call it the systematic problem, or how does it affect the overall system? Whatever they're doing, how is it affecting the system? And then finally we get down to the need or the basis of the problem, which usually is self-worth, significance, love, or security. Which we're sort of analyzing, going deeper and deeper and deeper until we get to what the real core or the root problem is here. What are the different kind of problem types that we're looking at? First was what I call a simplex problem. That means it's pretty simple. The person lost their job and they're depressed. Then we have what we call a complex problem. This is a problem like an addiction or codependency or something that affects their entire life. Then we might call dual diagnosis. That means we're dealing with two problems. And they have a drug alcohol problem and they also are schizophrenic. And the last is what we might call biologically based problems. They were in a car wreck, their brain has been damaged. And certain other mental illnesses that we know at least have a very medical basis to them. And those are many times considered like bipolar and schizophrenia and some of those kind of problems because their mind just isn't working right. And of course you can have a combination of all of those. So what are some of the insight skills that we can use to learn how to fit the piece of the puzzle together? Okay, you've done your gathering of data, you have your pieces, you have them all written down on your sheet, you've got 2 or 3 pages of all this stuff, and you're trying to process as you go along. What are some of the basic methods that you can use to deal with that? The first one I'm going to call logical deduction. How does it fit logically together? One of the big questions is, what are the payoff? See, the idea is nothing happens just because it happens. Everything has a reason of why it happens. I'll just take an example. As an example, let's just say this person just up and divorced their mate. Well, that didn't happen. I mean, they shouldn't have been walking down the street one day and said, I think I'll divorce them. There's some function to that. As an example, a function might be they have a great fear of abandonment, and for some reason that their mate said or something, they think their mate is going to abandon them. So they're going to abandon them first so they don't get hurt as bad. That'd be a logical deduction as to how the pieces of the puzzle fit together. And that's what we're always looking for. We got to get all those pieces and we play around with them sticking them together in different ways until they all make sense. And then that making sense is a hypothesis that we're talking about. Finding the precipitating events. Now this is important, because the person comes in and let's just say they're depressed. Well, there's one or two alternatives. They may have been depressed all their life and it's just gotten worse. Were they depressed as a child? Were they depressed as a teenager? Have they struggled with low-level depression all their life? Have they had recurrent depression problems all of their life? Or is this the first time they've been depressed? If it's the first time they've been depressed, what am I looking for? I'm looking for a precipitating event. I'm going to say, okay, what changed in your life? What happened? What have you been listening to? As an example, I had a client that had panic attacks and was very influenced by their environment. So if she came in and she had a particular problem, the first thing I would say was, okay, tell me what happened last week. As an example, in her panic attacks, a new thing was starting to happen. She'd be paralyzed on one side. So I said, okay, tell me what happened. See, now that had been happening all of her life, that's one thing. Tell me what happened. I said, well, I went to the doctor for a medication, and when I was sitting there was another lady sitting there, and she had panic attacks too. And when she had panic attacks, she was always paralyzed on the left side. Oh, well, I know. This lady was so influenced by ideas and so on that that was what it was, and it wasn't a major thing. She had just more of a copycat type of a thing that was going on there. See, when did it begin? How long has it been going on? Why did it happen now? Many times I'll say, a person comes in, well, we don't really know what the problem is. I'll say, okay, tell me, what was the crisis that got you to come into counseling? Because people don't just come to counseling usually. They'll put it off and put it off and put it off. Some crisis occurred, and that crisis will give you a pretty good idea of what's the root of what is going on here. And then look for pairing in past relationships. The idea is this. If you come into me and you tell me about an event, and it should create this much emotions, but it's creating this much emotions, what do I know? This much came from someplace else. This is a standard story that I use. Don't even know what the origin of it is, but the story is told that a lady was driving down the road and a jackrabbit ran in front of her car. And she tried to miss the jackrabbit, but she ran it over. And she cried for 3 days straight. Now, what do you think about that? In putting your piece of the puzzle together, what are your options and what do you think about that? Maybe she loves animals. Well, could be. When they finally got her to the counselor figured out that her favorite grandmother had died 3 years earlier and she had never grieved the loss. Death brings everything that's like it into the picture and drops it on top of it. And she didn't even know why she was crying. She was crying for her favorite grandmother that died. The death of the jackrabbit triggered all the feelings about death that she had and brought them into the present. So you have to look for those kind of things. You know, growing up, did anything like this ever happen to you? Something similar to this? Does this feel like something that you felt at some particular time in your life? Because those things may be related to what is going on and actually may be the reason the person is responding the way they are. Okay, the next method is, I'm giving you a whole list of methods here. They're fairly simple methods, but they're methods that work very effectively. Defense analysis. What does it mean? It means I'm looking at your defenses and what you're like, and based on those defenses, I draw conclusions about what's underneath those defenses. So you might think that if a guy walks into my office with a $300 suit, with a tie on, perfectly dressed, that I'm going to say, well, this guy must really be a professional, right? Well, he might be, but I'm going to say, okay, what's the problem? Why does he have to be so perfect? He may be so perfect because he's a perfectionist, because he has so low self-worth, this is how he is compensating with it. But it could mean he just came from work, and I'm going to have to sort that out. But I'm going to figure out the defenses. Why, as an example, can this lady why does this lady have no feelings for her husband? Well, in several cases that I have counseled, it's because the husband is a controller, and she feels that if she shows feelings for her husband will take advantage of those feelings, so she's told herself she has to kill her longings. That's very usual for sexual abuse victims. So the reasons for all of that in your job, you didn't know that you were learning to be a detective here. But this applies mostly to counseling, but it also applies to coaching, because you're going to have to find out what the situation is. I was coaching a guy, and it just seemed that we'd try this with this dream, but he'd shifted to this dream, and we were going all over the place. We couldn't get concrete at all. I started asking some questions, and he had a fear that God was going to call him to do something that he couldn't do or it would be too difficult. So I had explained to him, no, God has a mission for you, and he's given you the talents, and he wants to anoint those talents to do great things for him, but you're going to feel better, you're going to feel like you fit in when you find that. So he was afraid to allow himself to dream. So I had to figure that out. So this is a very essential skill. We have to figure these things out as we go along. I'll give you an idea of a few of these, okay? A person struggling with low self-worth or significance, these are the symptoms you'll see in defenses. They may be overly driven. They may be critical. They may have unwarranted jealousy, fear of failure. They may be a responsibility avoidant, perfectionist, or pride. All of those things are red flags that if I see those things, they're telling me there's probably a problem this person is striving to fix, a self-worth problem or a significance problem. How about love, intimacy problems, or nurturing? They may have an addiction to love, like romance addiction, relationship addiction, fear of intimacy, fear of rejection, people-pleasing, or relationship avoidance. Those are all going to be hints that the core issue has to do with love. Then in the area of security, people that have to be in control. Obsessions, compulsions, panic attacks, usually all tell you we're dealing with security issues underneath. See that method? The next one is called family systems or historical analysis. Going back, looking at their family, how they grew up, what was going on in their family, and how that data all relates to what is going on today. In the areas of marriage and family, what we sort of say is this: people marry to set up the unresolved problems in their family of origin. So there are a lot of things we can do here. See, did they come from an alcoholic, dysfunctional family or lack of intimacy? We're probably going to have some addictions. What was the relationship like with mom or dad or siblings or school or extended family? Could they live up to their parents' expectations? Did they have experiences of abandonment, divorce, conflict, sexual abuse? Were they abused? What type, to what extent? Did they feel okay about themselves? What was their place in the family? These are just all things you're looking for and trying to put together. Were they the hero, the scapegoat, the lost child, the mascot? What was their birth order? What losses have they had in their family? What unresolved issues? Are they still angry or bitter? How about triangulation in their system? Meaning that there's somebody else involved, like their mom has never been set aside and the mom gets involved in the family. Current conflict and abuse. There's a method, and I'm not going to try and teach it to you, take an entire session here. It's called a genogram. All genograms are is plotting out the issues of this generation, the next generation, and the next generation. And what do you think you're going to see? Let's just say the person has a sexual abuse problem right now. We're probably going to see that go right through the generation, or an alcohol problem, or a drug problem, or a codependency problem. You're just going to see it from one generation to another, and sometimes that's how deep you have to do to figure out some things and do analysis. How about marriages? I'm just giving you an idea of different things to look at. One of the types of marriage analysis I use, I look at the 5 types of love that are involved in intimacy. What are they? We have the commitment, which is the agape love. We have friendship or companionship, which is the phileo love. We have the goal orientation, or what they want out of life, that's the phileo. We have romance, that's the eros. And then we have physical love, or their sex life. And all 5 of those things make up intimacy. One of the theories of sexual addiction is that the person is using the sex or the physical love to make up for a fear in the other areas. They're afraid of getting too close to other people, so they make it up by acting out sexually. So again, those are pieces that I'm going to be looking at. Why did they get married? This is another trick of the marriage and family therapist. You have the 2 people there and you ask them, what was it that you saw in your mate? And what do they tell you? Well, they tell you usually the complementary things. Well, he was strong and he was solid and he was reliable. Well, guess what we know? Those are probably the issues in the marriage right now. That he's too strong, he's too reliable, she's feeling controlled, she doesn't like it. Usually it's the opposite, that the very complementary thing drives them crazy after they get married. So that's why you do something like that. Look for problems and ways of coping from previous marriages, families of origin. People repeat the same thing over and over and over again in that reparative drive to try to get the thing resolved. So you'll see, if there was alcoholism or domestic violence in previous marriages, guess what we're probably going to find in this marriage? Either the same thing or the extreme opposite. Maybe that's why this time they married an absolutely lackluster guy who doesn't stand up for himself, and he's an absolute wimp. And it's driving him crazy. And that's the problem in the marriage. Well, they just overly responded the opposite direction from the problems that they had previously. Previous marriage history. Then I have what I call my 4-question marriage analysis. You get a lot more if you take our marriage and family class on all this stuff. But basically, it is, do you believe that your mate has your best interest in mind? That's question 1. Question 2, does your mate love, or that's for the lady, or for the man, respect you? The next one, rate your marriage on a scale of 1 to 10, 1 being the worst marriage in the world, 10 being the best, and then rate your love life, your sex life, on a scale of 1 to 10. And from those 4 things, you can pretty much have an idea. Because see, the first one is the most critical. It's a magical line, and it basically says, are you my friend or enemy? If the other person doesn't have your best interest in mind, they're an enemy. And how do you get along with your enemies? A lot of problems. We have to get them on the right side of that line where they believe the other person has their best interest in mind. Another whole area of analysis, and we can't go into this in depth, but I just want you to know about it, is called transactional analysis. It's a whole field in secular counseling. But you see it and it's very useful. What it says is when people communicate, they either communicate as a parent, as an adult, or as a child. And we're going to find out in conflict. In a marriage, as an example, If the husband speaks down to the wife, so she feels she's being treated as a child, how well is that going to go across? It's not. And she's going to come back at him then, parent-child the other way. She's going to try to be the parent. In marriages, we need adult-adult type communication. But from that, you can figure out a lot of things. The next one, I call layer caking. It's probably the one I use the most of everything. I'm going to try to explain it to you, and then at the end, we're going to try and do a demonstration doing layer caking so you understand how it works. And here's the situation. You come into me, you have some sort of a problem, and I want to know how you're thinking about it, because your emotions are not based on the first thing you think. They're based on the last thing you think about it. Now, I'll use a standard example. Men are very much confused about women, particularly. Let's just say they're sitting down at dinner, and the wife has just made dinner, and she says to her husband, "Honey, how are the peas?" Well, what's she looking for? What he thinks, she is looking for an overall evaluation of the quality of the peas from a technical perspective. And if he says, like some husbands do that haven't learned yet, they're a bit cold and pulpy. And she cries and leaves the table, and he doesn't know what happened to her. That's because he doesn't understand the layer caking of what is going on. See, what is going on in her head? The first thing is, okay, she's made a meal, and she's a little bit concerned about the peas because she doesn't know if they taste exactly right. But if he says they're cold and pulpy, what does that mean to her? Okay, the first thing it means is he doesn't like my meal. But if he doesn't like my meal, what does it mean next? He doesn't like my cooking. And if he doesn't like my cooking, since women are attached to their environment much more than men are, he doesn't like me. And if he doesn't like me, he doesn't love me. And if he doesn't love me, I'm worthless. And so, from her point of view, he just said, "I don't love you and you're worthless." See the problem? Does he have a clue? No, because he didn't understand the layer cake. But you as a counselor need to be able to figure out why she's feeling the way she's feeling and what the issues are and what's going on. And you learn all sorts of things from that. Because people will take exactly the same event and they'll go totally different directions in that event and never make the mistake to think that it's going to follow a standard pattern. And of course, when it goes a totally different direction, you learn a lot about that client and you learn what is going on in their life. The next one, we don't use it too often, but again, a classical one from secular psychology, pictorial analysis, especially in marriage and family counseling. Because you got a whole family you're dealing with, and you want to sort of find out what's going on in the family. But especially with kids in play therapy. Have them draw a picture of their family. And what are you going to find in that picture? Certain people in the picture are closer together, and certain people are farther apart. And some people might be stick figures. See, what does it mean if the kid and the mom are at opposite ends of the picture, and mom is just a stick figure? What does that mean? It means the relationship is probably distant, or at least you need to look into it, and she doesn't know her mom well because she just makes her as a stick figure. Now, it may be different, but you use a pictorial analysis to ask questions to figure out what the picture actually means and why it is that particular way. The next one we might call biblical layering. We're trying to figure out, from the Bible perspective, what is really going on here. See, from a Bible perspective, what's the problem? Sin. And sin causes what? Guilt. The next level is we have a sinner, somebody that, because of issues inside of them, they tend to sin. And what's the issues here? The flesh and the self. Now, when would you use that kind of thing? More when you're trying to understand spiritual issues or how developed they are spiritually. Do you see what I'm saying? What's another way to do analysis? Use the analogies or Bible models that we give you, say, in the transformation course, or that we give you in the faith therapy class. Because you can take those and use the model and then say how much of that fits you. Because those are sort of standard ways of looking at things. Then we can do faith analysis. What is faith analysis? We want to find out where their fears are, but on the other hand, we want to find out where they have faith and what they can believe for. Because that has a big effect, especially in addiction. One of the statements is that in addiction, two things will determine whether you recover or not. First one is, do you believe you're going to recover? How much faith do you have you're going to recover? And the second one is, are you willing to do whatever it takes? If you get no to any one of those, you've got a big problem in an addictive area. And then we can use the faith ladder. Again, in other courses we'll be explaining these in much more depth. But the faith ladder basically says, what do you really think is going to happen in the future in your life? We usually use with addictions, but can use with anything. When you look at yourself at 85 years old, are you delivered from your addiction? Are you completely free of it? They say no, guess what you know? They don't have a lot of faith that they're going to ever recover from this particular thing. But how about if it's 5 years, 2 years, 1 year, now? And then we go the other way. Are you still delivered 6 months from now, a year from now? Remember one particular client I had, he was dealing with sexual addiction, and he had made it for 11 days. In 11 days he said, you know what? If I can do this for 11 days, I can do this forever. I'm free. That's how faith ladder works, how you can use that particular thing. And the last one is in Theophostic ministry. What they'll basically say is, you have a particular event, or something that's going on. They call that the echo. It means that's what's coming into your current life right now. And they say, I want just to ask God to take you back to a time in your life when you felt this way. And those connections between the one and the other are going to bring that together, and you'll go back and find another event, and then you can process that event. And that event and those feelings back there. One of the hardest things in counseling to break is experiences that the person had in the past that are connected and paired with the future, so every time this happens, the person feels that way. And you can analyze it by trying to follow the feelings back. Okay, I know that's a list of quite a few different methods, but we're going to try and home it, and I'm going to try and put this together. I'm going to give you an example. This is a composite of several clients, so it's a real example. Then I'm going to go through each one of these methods and basically show you what kind of information we would get in each one of these methods as we go through. Okay? Here is the case history. And what I want you to do is I want you, as we go through this, first I'm just going to give you the case history. We're going to take a break, and you're going to write down from the information I gave you and these analysis methods, try to apply some of them and reach whatever conclusions you can reach. Okay, then I'm going to go through this and show you from the different analysis methods what we found out. Okay, so here's your case history. You can take notes if you want in the case history, and we'll give you a break then to think of what analysis you can do on this. And also what questions you might want to ask that are not in the case history. But here's the case history. Jody has come to you for counseling because she has become irrationally jealous and is accusing her husband of having an affair with other women. They cannot even go to church because she will think he is paying attention to the other women in the church and accuse him of staring at them. One time he came home and there was an advertisement for women's clothing on the table. Even though he did not even see it, she accused him of lusting for the women in the magazine. They cannot watch TV or movies because if he does not immediately look away when other women come on the screen, she will accuse him of lusting after them. If he does look away, she will see that is proof that he was lusting and had to look away. When they were visiting another city with friends and a waitress was rude to her, she was convinced that her husband's female boss must have called the lady and told her to treat her badly since she was having an affair with her husband. Her husband denies that he has a problem with lust or that he has ever had an affair and wonders what has happened to the wonderful, loving wife who never seemed to be jealous in the past. What is your hypothesis? How would you analyze this case and what questions would you ask? What would you expect how would you expect the layer cake to come out? Write down your ideas. We'll take a short break and come back and then we'll discuss this. I hope that by now you have written down your hypothesis, your guess of what is going on, maybe the root problem that you're looking for, and what questions and what things you might do to try and find out the rest of it. So I'm going to go through this. I'm going to go through the same order that I discussed these different analysis methods and just talk about what we might be looking for, what we might find with them. The first one, the presenting problem, is irrational jealousy. The things we're looking for in identifying problems are feelings. What's the feeling? Fear. Jealousy is fear that somebody else is doing something, they're crossing a boundary line or something. What were the behaviors? Accusations and obsessions. She's just consumed with this thing, and she's making accusations. What's the negative thinking? That her husband is having an affair. What's the biblical thinking we might use to take care of that? God is able to meet her needs even if her husband fails her. God's involved in the marriage to meet her needs. See, she's afraid what? Her husband isn't going to meet her needs. That's why she is jealous. How does it function? Probably she's over-relying on her husband in this relationship. We'll have to ask that question and find out more to see more of what's going on here. What's the root problem? Insecurity, and probably feeling unloved or alone. Possibly could also be low self-worth. But because in this particular story, she wasn't jealous before, probably not. We don't really know that. We'll have to ask more questions. What's the hypothesis? Obsession based on insecurity. And she has this fear, and that's making her mind obsessed. And when it does, it actually distorts the person's thinking. That's why you finally get this very weird stuff that we said, how can a person possibly see it that way? They see it all through one set of eyeglasses. Everything in the world is interpreted through one particular thing. That's how obsessions work. Well, how about problem types? Well, this is probably a codependent issue underneath. But it could be also just a simplex problem. Something has happened and she's interpreted it wrong. Insight skills. Well, what's the payoff? How about that the accusations might keep her husband from ever having an affair? Another issue that tends to underlie these type of things is the person doesn't feel good about themselves, so they assume that there are a lot of other women out there that he would just want to have a lot more than her. So that would be the payoff. She's protecting herself some. Finding the precipitating event. Notice here, this is not a lifetime thing. If it was a lifetime thing, then I would go more toward the direction of self-worth issues, or something like that. Do you see what I'm saying? But because it's not a lifetime thing, she wasn't jealous before, we have to assume something has happened in her life that's made her more insecure than she was in the past. So you want to ask questions like, okay, if any crisis occurred, have you lost your job? What did you get your security from in the past? And has that been knocked out from under you? Have your kids left home? See, could this just be empty nest syndrome? Could it be that something changed in her relationship with her husband and she doesn't feel connected, or there's a distance? Look at paired relationships. In the past, growing up, have you ever felt this way before? Were you ever jealous of other kids as you were growing up? Were there affairs? Did your parents have an affair? Did your parents get divorced because of an affair? Your best friend. See, this could have just been triggered by an event that her best friend's husband was caught in an affair. And said, oh, well, why couldn't it happen to me? She was better than I was. Past boyfriends, past marriages that had affairs. Any of this kind of thing. We're looking for a trigger here. Defense analysis. Remember, I listed under low self-worth and significance issues, jealousy. Under need for control, obsession. That goes along with the insecurity. See, when you're afraid, your mind just focuses on that thing, just goes around and around and around and around. Family systems. We'd want to look at, could she live up to his expectations? Because if she's not, or if all of a sudden he's become critical, then she says to herself, well, why doesn't he like me? It must be, and a lot of women will go that direction, it must be he's having an affair. If a woman feels distance, the automatic conclusion is there's something wrong, he must be having an affair. Especially if they've been in a difficult situation in the past. One lady that was just totally obsessed in this had been a stripper. Well, what does she think men think? So we want to find out some of the other questions. How about abandonment issues? Maybe there's a tremendous fear of abandonment, and he said something or did something. Did he threaten to have a divorce in a fight or something? But something has triggered this because she didn't have the problem before. So we've got to find that thing of what is going on. We also want to do a marriage analysis here and ask those 4 questions. Because how do you think she's going to answer the first question about, does he have my best interest in mind? Probably not. We've crossed the line in the wrong direction. Or does he love me? Maybe not. It may be her just feeling that she isn't loved, so therefore she's trying to control him and make sure that he doesn't have an affair. Previous marriage history. Rape to sex life. Maybe the whole issue here is just an issue that for some reason, maybe he's gotten older and he's not interested in sex anymore. What would that say to most women? He's having an affair. Somehow she's gotten more insecure and she has this idea about having an affair. So how would we do a layer cake? Let's look at what a layer cake might look at here. I'll just give you a sample layer cake of maybe what we might hear here. This is the way I would do a layer cake. And I'll give you my statement on how she responds. If your husband is having an affair on you, what would that mean to you? And she'd probably say, he was unfaithful. And if he was unfaithful, what would that mean to you? My marriage would be over. And if your marriage was over, what would that mean to you? I would be alone. And if you would be alone, what would that mean to you? I would be destitute and miserable. You can see this go a lot of different directions. I'm just giving you one direction here. And why would you be destitute and miserable? Because I would be alone again without money and no one to care for me. And why would this happen? Because I failed again and I'm too old to get married again. And what would that mean to you? I'm worthless and just ought to die. So what's her fear? To her, the possibility of this affair or the insecurity is a disaster. It's a catastrophe. It's a huge thing. Her life would be over, it would be miserable. She'd just as well go out and die. So that tells me where she's really coming from. You see how important layer caking is and how that actually works. Pictorial analysis. If I had her do a picture, probably wouldn't, but if I did, I'd be looking at the distance between her and her husband in the picture and tell me she's not connected. Biblical layer caking? Well, I can go ahead, or biblical layering really, I can go ahead and say, okay, what sins has she committed and not repented of? Because that could be another possible issue here. It's possible she is having an affair, and she's projecting that on her husband. And what guilt has she not dealt with? Maybe she's feeling guilty, maybe, no, because of that I know God's going to get me. And so I know the thing I want the most is my marriage, so maybe this whole thing's going to collapse and it's all my fault. You see, this thing can go a whole lot of different directions like that. And then, where is she in her whole spiritual walk, in her whole spiritual life? What is her whole approach in that particular area? Then I can look for an analogy. We don't have a real good analogy in the Bible concerning this. The closest one would probably be a codependent, dependent, passive. The story of Sarah. Because see, Sarah had some jealousy issues with Hagar, didn't she? So we could use some of that to try and draw some of this out. How about faith analysis? Is she just waiting for the other shoe to drop? What's the issue here? How much does she believe that God will take care of her even if she doesn't have a husband? How much is her worth based on what her husband thinks of her? These are all issues to look into. And then finally, the whole theophostic thing. You have these feelings right now. Let's go back and tell me some other time growing up when you felt jealous like this. Or when you felt as insecure as you did, and what did you do? And what is going on in your life? So do you see, that's what we put together. So putting together, how would I analyze this? What would I say? My hypothesis is that she is having obsessions because she is feeling insecure and she's accusing him to try to cope with her mental obsessions so she can feel okay. And I need to ask more questions to see what the precipitating events actually were. In one of the cases I put together here, the precipitating events were that he got in a big project of taking care of the house, the kids left home, she lost her job, and he started working with the Boy Scouts. So she felt that distance. And that convinced her that he was having an affair, and then she was starting to use this to manipulate him to make sure that she kept him away from any chance of ever having an affair. And use it to get him to show her how much he loved her. Do you see what can be going on there? But unfortunately, the obsessions can get to the point that they get totally irrational and totally out of the box. And some of this stuff can be that way. But your thought says, okay, I'm going to have to go look at this relationship, but I'm going to have to focus also on getting her more secure, aren't I? Because something has changed here in the whole security area. But that just gives you an idea of analysis of where your first start would be. Now what we're going to do is we're going to set up, and I'm going to practice a layer caking here. What we're going to try and do here is a demonstration of layer caking. And so Gail, can you tell me a particular event that happened in your life recently that we can try to layer cake and see how you're thinking, so I can sort of teach you and show you how you ask the questions and how we figure this stuff out. When did that happen?
We recently went to Alabama to see our son and his wife there, and two little grandsons, or a granddaughter and a grandson. And I just had terrible, I just hate being away from them. I just, it's been awful.
Okay, since you came back, you're saying you had real feelings there.
Yes.
Okay, so the top
almost depression, but not.
Okay, so the top of the layer cake would be, what's the first thing that comes to your mind that you are now home and you're not with your, is it son and daughter?
A son.
With your son.
And daughter-in-law.
And what does that mean to you that you're back home and you're no longer with your son and daughter-in-law?
It's just not right.
Okay, it's not right.
Yes.
And if it's not right that you're not with your son and your daughter-in-law, what does that mean to you?
It means, well, I think grandparents should be with their grandkids.
Okay.
To see them more often.
Okay, and grandparents should be with their grandkids. And what does it mean to you that grandparents should be with their grandkids, but you're not?
It just means that, to me, it just means that I'm not getting to see them. They're not
Okay.
going to know their grandparents.
Okay,
Far away.
it means they're not going to get to know their grandparents, they're too far away. And if your grandkids don't get to know their grandparents, what does that mean to you?
They're going to lose out, and we're going to lose out. And their
Okay,
grandparents
you're
should
both
be
going to lose out.
Yes.
And if you and your grandkids lose out, what does that mean to you? What effect will that have on you and on them?
Well, it's probably going to have more of an effect on me because
Okay,
I want to be with them.
Okay, well, you're going to miss out on that part of your life.
Yes, I'm going to miss out seeing them
Okay.
sit up for the first time or walk for the first time.
Okay, and what's going to happen to them?
They're fine. I know they're fine.
You think that, okay, so I'm hearing primarily, and if you miss out on seeing them walk for the first time and see them do their first steps, all that kind of stuff, how is that going to affect you?
I don't get to see it.
Okay, and if you don't get to see it, how does that affect you?
It just makes me really sad because I want to be a grandparent, a more involved grandparent.
Okay, it means you can't be the kind of grandparent you want to be, is that what you're saying?
Yes.
And if you can't be the grandparent you want to be, what does that mean to you?
It just means that
I'm
just not
missing
fair.
out on mine. Okay, it's not
Yeah.
fair. Okay, and if it's not fair, what does that mean to you?
Okay, it just means that I just always picture things, being a grandparent, I always pictured I would get to see my grandkids at least once a month.
So my expectations
Yes.
in life are not being met,
Right.
and it's not fair. Now, one thing in layer caking that is interesting is that many times there are experiences in the past, and you see certain layers you need to experience that. When in your life, in the past, have your expectations not been met and you felt things were unfair? Has it happened to you very often?
I'm sure.
Well, you have any particular things you can think of that might be like this? Because see, that brings all the energy from the past into the layer cake at that particular level.
Okay. Well, sure. I miss my grandparents.
Okay? Okay, that's a very similar. It could be anything. You could have really issues of being unfair, like one kid was treated better in the family, or I was deprived when I was a kid from my grandparents. All those things are going to come in to your emotions and into this feeling. So your feelings aren't just based on what you said, but they're based on what you said and how that pairs with past experiences in your life to create the intensity of your emotions, and that intensifies that particular level. But if it's true, you're not with your grandkids as much as you want, and so you had all these expectations of being a grandparent, and you're being deprived of all of that, what does that mean about your life?
It means that I'm just not able to be the grandparent I want to be. I want to be involved in their life, but I can't be.
And what does it mean to you that there's stuff in your life, stuff that you want to do, and you can't do it?
Well, when they need a babysitter, I would like to be that babysitter, not.
I understand. Somebody else is going to have all these pleasures that you would like to have,
Yes.
and so you're going to miss out.
Yes.
And what does it mean to you if you miss out in life?
That means I'm going to miss holding them and.
Okay, I understand. But what is? We all miss out in life to some degree. What does it mean that you're going to miss out in this chunk of your life? See, is that a disaster? Is this a huge thing? Do you want to just pick up and move out there?
No, because I have 2 grandsons here.
So does it mean you're trapped then?
Yes, I am trapped.
You're trapped. You want to do this stuff here, but you want to do this stuff over there, but you can't do them both.
Not once a
And
month.
so you're trapped. And what else does it mean?
I would just love to,
You're sad because you can't have your cake and eat it too.
yes,
You can't have everything that you want in life.
yes, I'm spoiled.
So getting the idea of how we get deeper and deeper.
Yes.
You know, we'd like to get it all the way down though to a real more of a self-worth type of a thing. I mean, instead of a hard time getting down there. So does that make you feel more insecure? Does it make you feel unloved? Does it make you feel that you're not performing well enough? Does it make you feel worthless?
No, it makes me feel guilty because I'm doubting God for not letting them be close to me because He's doing mission work down there. And it's okay, but why?
Okay. And so I'm hearing is that it makes you feel more worthless because you're not doing things and you're turning it on yourself. And I should be trusting God. Well, I shouldn't be. You're saying to yourself, I shouldn't be feeling so bad. I shouldn't be depressed. I should be thanking God that they're doing mission work there and so on, instead of being sort of mad at God because God is depriving me of these great, wonderful
I'm not
things.
mad at God, but I shouldn't question Him.
Okay,
Why?
so do you see you're turning it on yourself?
Yes.
And so to see in layer cake and the different kind of pieces that we find out about you and how fast we can accomplish that. So that's an example of how you can layer cake.